It's Randy Neiswonger. Welcome to this edition of Community Beat. Today I have Dr. Pratik Patel. Dr. Patel, thanks for joining me. I appreciate it. Can you tell the audience a little bit about what you do here at Community Hospital?
Sure. I'm Pratik Patel. I'm one of the Cardiac Electrophysiologists here at Community, which is specialized cardiologists that specialize in arrhythmias. All sorts, from atrial fibrillation to ventricular arrhythmias, and we deal with pacemakers and ablations and things of that nature.
Thank you so much. You know, my hometown, Western New York, my beloved Buffalo Bills, you know, my beloved hometown of Buffalo, we oftentimes get negative press on our weather and some of the things that we've even seen this year. The football games have been relocated to other cities. Recently on Monday, we had a situation that occurred to one of our players on the field that caught national or maybe even international attention in the sporting world and other worlds alike. Can you talk through a little bit of what your observation of that event was, and maybe, you know, talk through what your thoughts are around that?
Sure. So just to kind of simplify and keep it basic for most of our viewers, what we basically witnessed was a cardiac arrest. A young player that was all of a sudden collapsed backwards, as many of you may have seen the video showed. And then when that occurs, what happened is the protocols of ACLS, where they started CPR, and as far as our knowledge is, they went ahead and did a defibrillation. And when you see defibrillation, it's an indicative of ventricular arrhythmia as a cause of your cardiac arrest. You can have a cardiac arrest for multiple reasons, but defibrillation generally is for life-threatening ventricular arrhythmias. So we know he required defibrillation for a life-threatening arrhythmia and was stabilized and then taken to the hospital where he's going through everything as far as recovery. Whenever we see a cardiac arrest from a ventricular arrhythmia, there are certain things that are on your differential diagnosis, so to say, to try what's the cause. Now, we can all assume he's a player, an NFL player, so he's probably presumably very healthy. We do know a lot of the professional sports teams do a lot of vetting and clearance of the players to make sure there's no underlying diagnosis or indication of any underlying heart disease, so we can presume that that's all probably normal in him. But they will do a full assessment of that, and we'll maybe get some answers over the next few days. Some of the buzz of what's been going on is this diagnosis called commotio cordis, which, based on what we saw, is very likely in this case. Now, and what commotio cordis is, it's the instigation, I guess to say, of a ventricular arrhythmia due to a direct, non-penetrating sudden impact to the chest wall. And it's a very rare condition that can occur at, honestly, it's a specific time. It's like very rare, but you have to hit at a certain point with a certain amount of impact at a certain part of the cardiac cycle that may predispose you to this arrhythmia. And it usually is associated with pediatrics, like kids from ages 12 to 18 or so, and usually with direct blunt hits from things like baseballs or hockey pucks. It's pretty rare in football. I have not heard of it or seen it, but if you look at the video, he did take quite an impact to that chest there. So commotio cordis is on the differential, and it's kind of a diagnosis of exclusion. They'll go through the process of evaluating for any of the other potential causes, and then if it's not, this may be felt to be what the cause is.
That's, you know, incredibly interesting. I know as a parent, you know, just to reemphasize what you said, it's extremely rare.
Very rare.
I know a lot of parents out there, and maybe even some of our viewers are sitting there going, should my kid play a sport like this? Any thoughts around the rarity of this, or you know? So
to speak specifically to commotio cordis, no, I do not think that we need to change what we do in this country or even internationally for, there's no screen for this. There's no way to predict this. There's no EKG or something that's going to say, oh, my kid's predisposed to commotio cordis. I think what this will end up highlighting is the importance of standby CPR and the use of automated defibrillators that I'm sure are mandated by law to be at all sporting events. But not only just having the presence of them, having training and having, you know, not just healthcare providers, but this is a skill that many people can learn and will be beneficial. So, particularly for our community, most of our high school sports or even the rec league sports, I guarantee you there are AED machines there, but this is a time maybe to revisit protocols and make sure people are adept at knowing what to do in case a scenario occurs.
I think that's really good. I think that's a really good educational component that we can pull from this. Ideally, as we start to look at sporting events and and different areas that could have a negative impact on this sort of situation, ensuring that we revisit those protocols. The nice thing is that the immediate response by the EMS, I heard, was very beneficial to the situation, to make sure that oxygenation wasn't deprived. And today we received reports that he was making some significant strides. What are maybe the long-term implications here for this player?
So what you just hinted to is the most important, is once you have a cardiac arrest, basically what that means is your heart's not pumping enough blood to all your vital organs. And to use a bad idiom, time is money. That entire time when you're not that's what CPR does. We're physically pumping the heart to get blood to all the organs to keep them perfused well. So immediate action is the most important thing. And so an NFL game, their personnel came, identified the situation, and initiated as quickly as possible. Now, obviously, we can always make improvements, but this is what goes back to what we take out of this, the learning process of what ACLS is, what CPR is, and the use of AEDs. The only other thing I would point out for all those parents that may be concerned, or even kids themselves, I understand. I mean, it's a scary situation. We saw the reaction of all the players, and even now people are worried. But once again, we do have to realize this is a rare entity, and sports are part of American culture, and even the international culture. It's something we enjoy, so we have to be wary to pull back on everything because of an isolated incident like this, while learning from it still.
Well, I know from my standpoint, I'm very grateful for your insight, your thoughts around this. Me personally, it hit really close to home because it is the team that I love. It's the team that I followed for my entire life. I'm looking forward to them getting back on the gridiron, but more importantly, I'm looking forward to seeing healing health. And I think the takeaway that we all could see is how this has pulled the sporting community together. There was significant contributions to his foundation. There were significant prayers from everybody across the nation, and I think we're all pulling for his health. And I'm getting really positive reports, or we're hearing very positive reports. So I'm looking forward to hearing that he has his full health and he's doing well. So thank you very much for your time and your insight.
Thank you.
Very grateful for that. And we'll see you guys next time on Community Beat.